Hi, I'm Mahin from The Wellness Puzzle, and I'm here today to talk to you about why scans, surgery, and medication are not always the answer in chronic pain. I'll also be touching on the NICE guidelines for chronic pain and their recommendations around medication, hopefully provide an explanation as to why they came to those recommendations and what that means for you if you are suffering from pain. So I just want to start off by saying that pain is complex, particularly chronic pain. Now, I've done a previous blog post on this and you can check that out. I will leave a link to that post in the comments below. Now, there's going to be a lot of terminology used in this video, and if you're going through the video and some of it's not making sense, start off with that blog post because it's a really good starting point in introducing chronic pain, what it means and why it possibly isn't going away as well. So a really good starting point. In that post, I talk about the biopsychosocial factors that influence pain. Now, that can sound quite complex, the biopsychosocial factors, and that's why it may be important to go back and read that post. But basically, our pain is contributed to by biological factors, psychological factors, and social factors. And for everyone's pain, there will be a combination of these factors that lead to the pain itself. We used to think it was just the bio part that led to pain, and these things could be seen easily on things like scans or blood tests, but we now know that pain is far more complex than that. And there are also psychosocial factors involved, which do influence our pain as well. So by recognising that these other factors are involved, it can bring us nicely onto scans and why scans don't always show us why we have pain or how much pain that we're in. So scans, they only show us the bio parts, so they show us the parts of our body and the structural parts of our body, but they don't show us much more than that. Now we can relate this similar to, let's say I have a problem with my computer, for example, okay, and I call somebody in to have a look at the computer to see what's going on. Now, let's say that person took this computer here and they undid the screws at the back and they had a look at this panel on the inside. Now, just by looking at those wires, they aren't going to be able to tell what's wrong with the computer, the software, and what's going on inside it. And this is very similar to scans as well. They show us the structure, they show us the parts that are there, but they don't show us how the body's working as a whole. It's very normal to have scan findings return normal and still have pain, okay? Alternatively, it's also very normal to have abnormal findings on an MRI scan or an X-ray or a CT scan and not have any pain. So what it really tells us is actually the scan results do not always fit in with whether somebody has pain or how much pain somebody has. So when we get scan results back and we hear things like disc bulges or disc degeneration or arthritis or big words such as spondylosis, we often think the worst with that because they are big words, they are worrying words, okay? But in the normal population, these things are actually very normal to have return on scans. So even people without any pains will have disc bulges, disc degeneration, signs of arthritis, and so on. And they may not have any pain associated with that. And that's extremely normal. It's very normal to have things like disc bulges and disc degeneration and have no pain at all. So just imagine now that you have had lower back pain. Come on, let's say you've had lower back pain for a few months. You go and you get a scan. Now, when that scan comes back, let's say it shows a few disc bulges, it shows some disc degeneration, it shows some spondylosis, okay? We're just throwing out some big words there, like spondylosis, because that's sometimes things that come back on scans. They can sound quite confusing and also quite worrying. Now, you've had those scan results back and you've had pain for a certain period of time. With those results coming back, obviously that's going to promote more fear that's been felt inside of you. Now, with that, do you think that's going to make you feel more comfortable with movement or less comfortable with movement? I know if I have lower back pain and I have a scan result coming back and it showed disc bulges and so on, and I didn't know that those things were normal, I'd be more worried about doing things like, let's say, bending, lifting, and so on. And, you know, we're humans at the end of the day. That's extremely normal to feel a little bit more apprehensive around movement when we've got those results back. And that's a classic example of why scans or imaging are not always helpful, okay? And they can actually lead to worsening function and a worsening quality of life because of these findings coming back and promoting more anxiety or fear around movement and so on. So it's really important to trust your health professional when they say a scan isn't indicated. They're not just saying it because they're trying to save a little bit of money, but actually it is clinically not always appropriate to send people for imaging because there is a likelihood that something will show up, but that something is a very normal finding and often can be a bit of a red herring and also provoke a little bit more fear in people. So we are saying that for clinical reasons, not just cost-saving reasons, which I know often is thought about health services such as the NHS, but actually from the studies that have been done, when people have unnecessary scans, scans that aren't indicated, it can actually lead to worsening function and ability because of the reasons I mentioned earlier. So just those things come back, it provokes a bit more fear, that fear stops us from doing things and the pain gets worse over time. So it is really important to kind of acknowledge that always scans aren't indicated. There are certain situations when a scan is absolutely indicated, and that's what your health professionals train to recognise and pick up on. Now, the last thing to mention about scans is if you do have a scan and there is something serious going on, depending on the type of scan you have, that scan should pick up on that thing. So let's say if you have a fracture or you have a tumour or anything like that that's in any part of your body and you are scanned in that area of your body, that scan is very likely to pick that up. So scans are very, very good at picking up serious things or damage or worrying things that we need to act on straight away. But past that, they aren't that helpful in telling us why somebody has pain or how much pain you're in. So there's a little bit of reassurance that can be taken from scans when they return normal, because the more serious stuff can be more likely to be ruled out. There are sometimes more investigations that are needed to rule serious things out, but I'm not going to go into that in this video. But I understand that although the scan comes back normal and that can be reassuring from a serious point of view, it doesn't always provide answers to why the pain's there. And scans just can't do that. We can't just put pain down to that bio part alone, as I mentioned earlier. So scans show the structure, but they don't show the other factors that may be involved in pain. And pain can not only be seen on a scan that only shows structure. So moving on to surgery then. So don't forget, I'm only talking about chronic pain in this video, and things like scans, surgery and medications are needed for other conditions, other medical conditions, but I'm not talking about that in this video. I'm only talking about chronic pain itself. So I talked about how scans only show the bio part. Now the same kind of applies to surgery as well. So surgery looks to fix a specific structural issue. However, your pain may not be there because of structure alone. So that's why surgery, a lot of the time, can be quite ineffective, especially in the long term. As a general rule of thumb, the longer that you've had pain for, the less effective surgery is likely to be. Again, very dependent on what type of condition that you have. However, surgery isn't always effective in the long term because it, again, only focuses on that bio or that structural part. It's also quite ineffective if you've got pain at multiple different parts of your body. So we call this widespread pain or multi-site pain. So for example, if you've got pain in your shoulders, back, neck, lower back, knees, hips, etc., then surgery on one of those areas isn't likely to have a good effect on your pain overall. So surgery in one area won't reduce the overprotectiveness of that pain system. It will only address that one area, and as I mentioned earlier, that one area may not be painful due to structure alone. It's likely if you've got pain in different parts of the body, it's due to that overprotective, oversensitized nervous system that's causing that pain rather than a structural issue alone. So again, if you need to go back and have a look at that blog post, please do, because I am talking about things that I covered in that post. And if some of this isn't too clear, such as protective systems and nervous system sensitivity isn't quite making sense, then please go back and read that blog post that I mentioned before. The link is in the comment, and come back to this video afterwards if you need to. You can rewatch this video. I'm going to be here So just to get a better understanding of those terms and then come back onto this. Back to that point that I mentioned at the beginning with pain being complex, this is the reason that there is no one cure or fix for chronic pain. Now, often things like surgery are looking to provide that fix for something, but we know that a lot of people who've undergone surgery for chronic pain have still had the same amount of pain post-surgery as well. You may get people who've had that initial relief, but then that kind of pain comes back. So unfortunately, there isn't that one cure or fix for chronic pain. However, because of the many different factors involved, there are many different things we can do to help to manage pain. And that's what this YouTube channel is about and my blog's about. And hopefully, I can help you discover some of these strategies to manage pain. I just want to mention that in a very small number of cases, surgery is absolutely necessary. And when you have your assessment by your health professional or your medical professional, they will assess for that. So it's a very small percentage of people. Obviously, surgery does have its place and it does a very, very good job. However, it isn't needed for most types of chronic pain. And I would always discuss, if you are concerned, discuss that with your health professional. Okay, so now the big topic, medication. So as I mentioned in my previous video, I'm an independent prescriber, so I do prescribe medication for my patients when needed. However, this is a very, very, very small number of patients. More of my role is around reducing medications that people have been on for a long time, but we'll come on to that in a moment. The first thing that I do want to mention is there is no such thing as a painkiller. Okay, so with pain, there is no medication that completely 100% gets rid of pain forever. Okay, you may get medications that help in the short term and take away a significant amount of pain. However, there isn't that much evidence to support the long-term use of medications. And there definitely isn't such a thing as painkillers, which just removes your pain and it doesn't come back. Often, as a rule for medications, the longer that we've been taking the medication for, the less effective it becomes over time. Now, this is just because our body develops a tolerance to that medication, which then means that it stops working as well as we kind of take it more. And it can also sometimes lead to us then needing or thinking that we need higher levels of that medication. Okay. Now, this is particularly the case for medications such as opioids, which are your cocodamols, your tramadols, your morphines, your fentanyl patches. I'm going to talk more about opioids in a future video. However, what I do just want to mention here is that because the medications such as opioids, because we develop a tolerance to those the longer that we take them for, it can lead to a situation where we start off on a very low dose or a weaker opioid, let's say cocodamol, and we take that for a while. It might work well at the beginning, but then after a few weeks, few months, the effectiveness starts to reduce. So we go back to our prescriber, whoever prescribed that medication, and we tell them, okay, the medication isn't working as much as it used to. So the prescriber then might consider and they might put you on a stronger medication or a higher dose. And let's say from cocodamol that goes up to tramadol. Now again, that works for a little while, stops working, we go back to the prescriber, they put you then on something stronger, which let's say that's a fentanyl patch or a morphine patch, and then what happens actually is you are now on a very, very high level of opioid, and these come with lots of different side effects and long-term risks. And again, it works for the first part, but then it stops working. So very quickly you're on a high level of medication that isn't providing much benefit, but has lots of side effects and long-term risks. And we call this the medication treadmill. So that's where you're put on increasing doses or increasing strengths of medication without much long-term benefit. So a key point to mention here is that all medications come with side effects and potential long-term risks. So if you have been taking medication for a period of time and it isn't helping your pain anymore, please speak to your GP, your pharmacist, or your pain specialist about gradually reducing this medication. A lot of medications can't be stopped completely altogether, and they do need to be gradually reduced. So it's important that you do this under guidance, but have that discussion with your health professional about reducing that medication if you've been on it for a period of time and you're not getting much benefit. Even if you aren't getting any side effects as such, there can still be some long-term risks. So it's really important if a medication isn't working, then speak to someone about reducing that medication. Just got a plant delivery. Nice one. Okay, so plants looking good. Let's talk about the NICE guidelines. Earlier this year, 2021, NICE released their new guidelines for chronic pain. Now, in the guidelines, they only recommended one type of medication for chronic pain, which was antidepressants. From the studies that they looked at, they found that antidepressants could have a positive effect on quality of life, pain, sleep, and psychological distress when compared to a placebo. But there were limitations in the quality and the amount of evidence. NICE also recommended against the use of specific medications such as antiepileptics, which are pregabalin and gabapentin, diazepam, anti-inflammatory medications, paracetamol, and opioids as well. And that if anyone is taking these types of medications for chronic primary pain, and that's pain that has no identifiable underlying cause, like we discussed earlier around scans, or pain related to another condition, then if you are taking those types of medications and you aren't getting a benefit from them, then to speak to your GP, your pharmacist, your pain specialist, or prescriber to discuss gradually reducing these types of medications. You can, of course, continue to take these medications if you are getting a benefit, as long as it's at a safe dose and the side effects and risks are minimal. However, if you are concerned, please speak to, as I mentioned, your GP, your pharmacist, or your pain specialist. So I know you may be thinking at this point, well, what are my options? You know, if all these medications, apart from antidepressants, are advised against, what can I do to help with my pain? Well, the good news is there's lots of things we can do to help to manage pain, and medications are only a very, very, very small part of that, and usually quite an effective way of managing pain. So there's many other things that are more effective at managing your pain. Now, this is what this channel is about. So if you haven't already, hit subscribe below. Also share this with anyone you feel it may benefit, because we are going to be talking about those other strategies that aren't medication in future videos as well. So all of these other things come with less side effects and less risks, but they come with more of a benefit to your quality of life and your function, and help you get back to the things that you want to be able to do. So the truth is really that medication is often just not the answer in the long term, but there are many other things we can do to help to manage pain. Also important to mention is that these recommendations are made to keep people safe and maintain a good quality of life. Now, all of these medications that I've discussed today, they all come with side effects, okay? There is no medication that doesn't come without a side effect. Now, common side effects of medications are things like drowsiness, mood changes, irritability, nausea, stomach issues, constipation. All of these things are very normal when taking medications, and it doesn't even have to be at a high dose to experience these side effects. Now, with these side effects, sometimes what happens is that we need a second medication to control those side effects, which that medication also has side effects, and then we need another medication as well to control those side effects. And we can get very, very quickly again onto this medication treadmill, and we can end up on lots of different medications doing lots of different things. But the primary thing it's aiming to do is improve your pain, and often that isn't the case where it is helping with the pain itself. So these medications actually can have a negative effect on function and quality of life as well. So these recommendations have been put in place to reduce that, and also to stop people getting on those higher levels of medication with all of these side effects and little benefit. The other reason these recommendations were made is because a lot of medications that were listed as not recommended, they all have a poor effectiveness of managing pain in the long term. They may have an initial good response, okay, so you may have, a few weeks of better pain control, However, we know that once that tolerance is built up and those medications become less effective, then actually what happens is it's more visits to the prescriber, and often, stronger medications are used or higher doses are used, which again just puts you back onto that medication treadmill as well. So we're seeing a bit of a pattern here. So just to conclude, it is absolutely your choice whether you want to be put on a medication or not. Just because the NICE guidelines recommend things like antidepressants does not mean you have to take it to manage your pain. Medications are not the best way at managing pain in the long term, and all medications come with side effects, including antidepressants as well. So it's much more worthwhile discovering non-medication strategies to manage your pain without the side effects, without the long-term risks, but still getting back to the things that you want to be able to do and you enjoy. So guys, thanks for watching this video. I hope you found it informative and helpful. And just a couple of last things that I want to do is just signpost you to a few things. So again, in the comments below, I've got that chronic pain blog post that I did, a really good reference point and a really good introduction to what chronic pain is and why it persists as well. The other thing I just want to point you towards is the NICE guidelines for chronic pain 2021. I'll post a link in the comments to that as well, alongside a couple of links to different websites that are really helpful and have some really good resources on there for both people suffering from chronic pain, but also clinicians as well to use with their patients. And lastly, don't forget to hit subscribe below if you haven't already, and please share this video with those that you feel it will benefit, and I look forward to seeing you soon. Take care.